APD is an NGO that has shown success in its service to the challenged, underprivileged folk. At APD, a team of officials is reviewing the day's planned activities. First on the team's focus is the subject of spinal cord injury and APD's Social Rehabilitation Center at the premises. Here, a small batch of severely disabled is undergoing physiotherapy as part of a specialized training program. All trainees suffer from severe spinal cord injuries. The spinal cord is a crucial part of the human body, a pathway along which nerves transmit information between the brain and the rest of the body. An injury to the spinal cord impairs movement and sensation, resulting in the inability for some people to walk or use their arms. Bowel and bladder control, as also basic breathing function, may also be affected in some cases. The spinal cord can also be affected by diseases like tuberculosis and damaged by accidents, violence, or extreme spinal strain causing human action. Arresting spinal cord damage involves restraining the spine and controlling inflammation, mostly through surgery. Chennavira was a youngster with a happy family when an automobile accident severely injured his spinal cord. He was referred to a major hospital that operated upon him for spine stabilization. However, his surgery saw no change in his paraplegic state, with loss of movement and sensory functions in his legs. Chennavira was not able to control his bowel and bladder. The hospital told his family that with time, his condition would improve with home care. Sadly, even after months, his physical condition remained the same. Spinal cord injured patients face the situation after surgery. In a few months, dejection sets in them, bringing anger, helplessness, depression, and in some cases, suicidal tendencies. Like Chennavira, his co-trainees at APD, Prakash, Kumar, Santosh, Manjunath, and Honaya too had similar body conditions caused by injury to their spinal cords. None of them recovered after their surgery and discharge by the hospitals. For such cases, hospitals would need to care for them as inpatients, providing rehabilitative care during the golden recovery period of 3 to 6 months. However, most specialty hospitals that offer excellent facilities for treating spinal cord affected patients discharge them soon after their diagnostics and surgery, and do not provide a scientific inpatient rehabilitative care during the golden period. Hospitals focus more on the urgent need to treat incoming patients. Moreover, very few hospitals have a specialized section to rehabilitate patients for the full term required. Government hospitals find it difficult to cope with overflowing numbers of such patients. Ironically, the majority of spinal cord injured come from the marginalized sections of society. Even after months of home care, Chennavira was fully dependent on his family members for his personal day-to-day activities like bathing, changing clothes, toiletry and mobility. The future seemed bleak for the young man. That was when his family approached APD for help. Since the year 2001, APD has been training the spinal cord affected to be independent with a far-reaching program of social rehabilitation. Chennavira and others like him were enrolled in APD's residential training program. They were first counseled by trained professionals and then began their program of physiotherapy, followed by classes in the use of crutches, walkers, and wheelchair for mobility. APD offers its trainees wheelchairs that are specially sourced from abroad and adapted to individual body conditions at its workshop. The trainees are taught the basics of wheelchair assembly and mobility. Assistive devices are also made at APD premises, measured, molded, and finished to suit every case. Occupation therapy, sport, and co-curricular activities are elements in their road to recovery. Eminent doctors from leading hospitals visit APD on a regular basis. These doctors are specialists in physical medicine and rehabilitation. They monitor the progress of the trainees and advise APD on the progressive actions to be taken for every patient. Dr. Naveen examines Prakash. He says,
now he complains of severe back pain, and this is very common problem in spinal cord injury patients, which can interfere with their activities of daily living, it can interfere with their work, it can interfere with their night sleep. This can be treated by lots of medicines. With proper physiotherapy along with postural correction and medications, his pain should be alright and he can go back and do his proper work in a fruitful manner.
Channavira is being examined by Dr. Rajalakshmi. She says,
he needs to control his weight, control his diet. This is often also a problem that is commonly ignored in spinal cord injury. They are more prone to develop hypercholesterolemia, hypertension, sometimes even diabetes earlier than in people without spinal cord injury. And we hope that with treatment and with lifestyle modifications, Channavira will control his BP and lead a healthier lifestyle.
Dr. Maheshwarappa is examining Manjunath. He says,
Manjunath has a difficulty in passing urine and also passing motion. So he is undergoing training for toiletry function. So he should be able to manage the toilet activities independently without any embarrassment after going home.
It is 2 months into the program and Channavira and his friends are now expertly mobile. They get on and get off their wheelchair to their beds, manage their bowel and bladder, wash their clothes, and have also learned to cook as part of their program. These activities have not only given them the dignity of independently taking care of themselves in their life ahead, but also to confidently interact as responsible members of society.